Assalamualaikum, my name is Ruziana Masiran and I'm presenting a review paper with the title Parent Training Programs in Southeast Asia, a scoping review. As an introduction, I'm highlighting the issue of emotional and behavioral problems among children in the region. Prevalence of this issue varies from one country to another and it ranges between 8.5 to 30%. Most importantly, we do know that parenting programs have been shown and advocated to improve not only parenting practices but also parental well-being and the level of emotional and behavioral problems in children itself. And even in countries with sparse resources, it has been demonstrated that such parent training programs are feasible. And when we talk about the region, Southeast Asia region, we know that there are large disparities in social, political and economic situations which translate into the way how mental health problems are being addressed and how healthcare services are being developed. And the lack of mental health professionals, community mental health services, limited resources in the region are known. And even in top 2 countries with the highest psychiatrists per 100,000 populations, Singapore and Brunei, they have 2 psychiatrists per 100,000 population, around 2 to 3 psychiatrists per 100,000 population, but this is still very low. So the problem here is that there is a huge gap which exists between the countries in Southeast Asia region and the Western countries with regards to parent training program implementation and effectiveness. And currently, as we are fighting against the pandemic, there is an increasing number of children with severe emotional and behavioral issues. As a consequence, there is an urgent need to provide affordable, accessible and feasible parent training programs to help parents across the region cope with the stress of parenting, and hence an understanding of the situation in the local parenting intervention field based on existing evidence is required. So this scoping review actually investigated the literature published on all parenting programs conducted in the region, focusing on improving children's emotion or behavior, as well as focusing on improving parenting practices and well-being. So we wanted to identify, describe and characterize the scope of parenting programs conducted in Southeast Asian countries. So we use Prisma method, we use the Prisma 4-phase flow diagram, and we searched the databases which included Scopus, PubMed, Cochrane Library, Google Scholar and AppCohos with certain keywords which included parenting program, parent training, parent education, Southeast Asia and all the name of countries in the region. So at the end of the process, after exclusion and screening, we included 11 articles. And what we found is that although we have 11 Southeast Asian countries, only 7 countries had research done with regards to parent training programs. 5 of them actually employed randomized control trials. Others used pre-post design and quasi-experimental studies. One article described qualitative study with in-depth interview, focus group discussions and survey. And I think majority of these programs were done in the community. 4 studies actually describe clinical setting of intervention. And we also found that in terms of directions of parenting programs in the Southeast Asia, some studies actually explicitly mention the rising issues of emotional and or behavioral problems among children, but other studies actually mention the issue of family violence and child maltreatment, and therefore the parenting programs conducted actually aim towards offering intervention to tackle those different issues in different countries. Furthermore, some studies actually focus on training the parents the skills to manage children's negative behavior. Some actually train parents on strengthening parent-child relationship, and some actually enhances parenting self-efficacy among parents and caregivers. And we identified 2 kind of parenting programs in the region. One is what we know as locally developed parenting programs, or what we call home ground program, and another one is foreign programs brought into the country, which is known as transported parenting programs. And those transported parenting programs may or may not be adapted, meaning to say that countries like Singapore actually use wholly the original program in English without any translation or any adaptation, while some countries actually use superficial adaptation in terms of translating certain words, or actually making some training session accustomed to the local culture. So based on these two type of programs, the homegrown and also the transported programs, we also found out that transported programs may or not be adapted either superficially or in terms of deep adaptation. In terms of parenting program acceptability and feasibility, just a few study, I think less around 3 to 4 studies actually reviewed and reported program acceptability and feasibility among local participants. And most actually documented moderate to good program attendance and attrition. However, there is a lack of follow-up data in these studies, so this has limited our understanding on program sustainability. So we do not know, there is no information on further analysis of long-term effectiveness of parenting programs in the region. Now we come to the discussion part. I think the novelty of this study lies in the fact that we actually examine the available evidence-based programs in the region with economic, racial, and cultural diversity. So I think ultimately this review actually supports the notion that research evidence in the parenting intervention field in Southeast Asia is still scarce. In fact, parenting programs that we reviewed were found to be few and far between. And then another point that we mentioned earlier is that the fact that the programs had different research directions and characteristics. We observed that many programs were conducted in clinical setting and also welfare setting. It actually corresponds to the fact that, to a meta-analytic finding, that treatment-based parenting intervention studies were associated with larger program effects than prevention studies. The fact that a lot of parenting programs done in the region were targeting the welfare setting, that means children who are associated with social welfare. The fact that a lot of studies are done to them is actually supports the finding that actually if we do parenting programs on those who require the programs as treatment rather than as prevention, so it actually supports that fact. And the two types of parenting programs in the region, one is homegrown and transported. Although some countries actually used transported parenting programs without any adaptation, the importance of cultural adaptation process of parenting intervention must not be undermined. In general, culturally adapted intervention were demonstrated to have five times greater odds than other interventions to improve mental health problems. But our review, this scoping review actually has a number of limitations. First, it's just limited to published articles, but we also included reports, books and book chapters. So it's hard to make conclusions which can be generalized to other setting. And then there's one study which we actually, because we excluded children with autism, but this particular study by Gemestat et al. 2020 actually was done on parents and siblings of children with various neurodevelopmental disorders. But unfortunately, this list of neurodevelopmental disorder actually included autism. And lastly, the overall number of articles, which is just 11, actually is too low, probably make it more difficult to be valid or to utilize, or to make conclusions from it. As a conclusion, the scarcity of implemented parenting programs in Southeast Asia region, as demonstrated in this review, suggests the need to administer and disseminate these programs around the region. So one option is to transport readily available evidence-based parenting program with or without cultural adaptation. This could be a more strategic approach to meet the need for parenting interventions in the region. And collaboration between program developers and local mental health practitioners in the region could be strengthened to promote this dissemination. And finally, we suggest that perhaps parenting programs, it is time to employ technology-enhanced service delivery. For example, parenting programs through Zoom meeting or any online platforms, to ensure universal access to parenting intervention during the current pandemic without risking any intervention fidelity and public health measures. With that, I thank you.